So welcome everyone to this webinar entitled Care for Your Discs, the Back Pain Solution. It is brought to you by all the doctors and staff here at Gonstead Physical Medicine. We are located at 2735 West Union Hills Drive here in Phoenix. Our number is shown there on the screen at 602-973-1630. Our website and my email is also listed there as well. So if there's any questions you had that we didn't get to answer, if there's anything you'd like to know about the office, you can check out our website or shoot me an email. I'll be happy to get back to you on that. My name is Dr. Scott Timko. I'll be hosting our webinar here tonight. I'll give you a little background on myself. I'm originally from Western Pennsylvania, just outside of Pittsburgh. I did my undergraduate studies at the University of Pittsburgh, went on to receive my doctorate in chiropractic from Sherman College of Chiropractic in Spartanburg, South Carolina. I've been in active practice for the past 27 years, using chiropractic, physical medicine modalities, therapeutic procedures, and functional medicine to help thousands of patients restore and maintain their health. I'm currently working here at Gonstead Physical Medicine, which we have a multidisciplinary practice with several doctors on staff here as well. So to get us started tonight, I wanted to talk about the anatomy of the spine. To understand how anything functions, you first have to look at its structure, and structure equals function in many cases. And so to start off tonight, we want to look a little bit about the anatomy of the spine. I promise I won't go into too much detail and overwhelm you, but we certainly need to know how the spine functions. We know the spinal column provides the primary support for your body, allowing you to stand upright, to bend and twist, while protecting the spinal cord from injury. Strong muscles, flexible tendons, and ligaments hold the spinal column together and allow for its flexible movements. The spine is made up of 33 individual bones stacked one on top of another and divided into distinct regions. The first region, the neck, also called the cervical spine, is comprised of 7 vertebrae. We use the C from cervical and number those C1 to C7. The next region throughout the mid-back is called the thoracic spine. This is the area where the rib cage is at. We have 12 pair of ribs that attach to these vertebrae in the back and to the front to the sternum. Those vertebrae again are the thoracic spine, and we number those T1 to T12. The next 5 vertebrae are those in the low back. Those are the lumbar vertebrae, or the lumbar spine, again, L1 to L5. The sacrum is next. This is a solid segment in the adult. In the fetus and in the small children, those are unfused segments, but as we get into toddler's age, those segments actually fuse to form the sacrum. Coming off the sacrum, the small tailbone, if you will, is called the coccyx. Again, this is 3 to 5 fused segments. And so you can see all those segments adding together to 33 individual bones. Of course, there are 24 vertebrae, then the sacrum and the coccyx. This picture shows the spine, the left view from the anterior front, the middle view from the back, and the side view is the one on the right. We see I have labeled here on the left the 7 cervical vertebrae, 12 thoracic, 5 lumbar, the sacrum, and the coccyx. On the far right, you'll see the picture of the spine showing some curves. Now again, this is a lateral view. The left side would be facing forward, the right side is facing backwards. And so we have a few curves that we need to discuss when it comes to the lateral view of the spine. The neck actually has a forward curvature, which we call a lordosis. The thoracic spine curves backwards, which is called a kyphosis. And then the lumbar spine curves forward, again, a lordosis. And then the fused sacrum curves backwards again, and that is called a kyphosis. Now, these curves actually have specific degrees that we can measure to see if they fit within the parameters that we like to see in chiropractic. And that's why we'll take x-rays on our patients to determine whether the spine is straight from the anterior and posterior view. If there's any S curves within the spine, we call that scoliosis. And then from the lateral views, we're able to measure those curvatures to see if the lordosis and kyphoses are in the correct positions. The foundation of the spine is called the pelvis. The pelvis consists of paired bones called ilium, connected in front at the pubic symphysis and connected to the sacrum in the back by the right and left sacroiliac joints. A cup-shaped socket called the acetabulum forms the hip joint with the head of the femur or the hip bone. The pelvis provides attachment for muscles that balance and support the trunk and move the legs, the hip, and the trunk. Some of these, of course, are the abdominal muscles, the gluteal muscles, the piriformis, the psoas muscles, the hip flexors, hip extensors, and many others that support the pelvis and the spine. And now the ever important discs. We know each vertebrae in your spine is separated and cushioned by an intervertebral disc to separate the bones. Now, it does a lot more than just separate the bones. We know there are a total of 23 vertebral discs in the spinal column. There are no discs between the skull or the occiput and C1, and there's no discs between C2 and C3. Those are special vertebrae, and there's no discs between those, but the rest of the vertebrae between C2 and C3, the whole way down between L5 and sacrum, all have discs, and so there are 23 discs in our spinal column. Each disc is made up of a gel-filled center called the nucleus pulposus and a tougher fibrous ring called the annulus fibrosus. So we can think of this as a jelly donut, where the jelly on the inside is the nucleus and the donut surrounding that jelly is the annulus. It's the annulus's job to keep the bones pulled together in place and act as a protective force for the nucleus. The nucleus functions to distribute hydraulic pressure in all directions with each intervertebral disc under compressive loads. And so anytime we're putting pressure on the spine, whether it's just standing, sitting, or whether it's lifting, bending, or twisting, those compressive forces being applied to the spine are distributed equally out through those, the nucleus and out through the annulus. So very important job that disc has. Here you can see some pictures. On the left, it's a lateral view of the spine. You can see the vertebral bodies separated by the disc, and we can see the annulus fibrosus on the outside. In between each of those vertebrae to the right of the disc, you'll see a hole where the nerves come off of the spinal cord. That hole is called the intervertebral foramina. In Greek, that just means the hole between the vertebrae. On the right side, we're seeing a superior picture, or we're looking down at the top of the disc in the vertebrae, and you can see that jelly-filled center called the nucleus pulposus, surrounded by the annulus fibrosus on the outer side. So we hear the term slip disc a lot. And so we're going to describe what a slip disc is, and we're going to be a little bit more specific about it. So if a disc between two vertebrae starts slipping out of place, it can irritate the surrounding nerves and cause all kinds of problems, including extreme pain. A slip disc can be a term used to describe a bulging disc or a herniated disc. It refers to the fact that the disc is starting to degenerate and can no longer perform its job. And we already mentioned the importance of those jobs that the disc does, so it's really important that we have the integrity of that disc in mind. So what's the difference between a herniated disc and a bulging disc? Well, a bulging disc is a term used to describe what happens when a disc starts sagging and losing pressure or elasticity. These changes can cause the outer layer of the disc, again the fibrosis, to bulge out fairly evenly all the way around its circumference or part way around the circumference. So it looks a little like a hamburger that's too big for the bun. In contrast, a herniated disc is a term used to describe what happens when there is a tear or a hole in the annulus. This allows some of the softer inner cartilage to protrude out of the disc. And in the picture that we're seeing there, you can see that red spot showing a herniated disc. Obviously, that disc can bulge out. It can put pressure on the nerve roots. It can put pressure on the spinal cord. It can create a multitude of problems. So compared with a bulging disc, a herniated disc is more likely to cause pain because it generally protrudes farther and is more likely to irritate the nerve roots or the spinal cord itself. There's another illustration to show us the difference between a bulging and a herniated disc. So on the left side, we see the bulging disc, and we see in this particular instance, it's not the entire way around the circumference of the disc, but you see the red there is showing a bulging around part of the circumference. It's pushing out, and it looks like it's touching that nerve root a little bit. On the right side, we do see a herniation. So you see that nucleus pulposus, the dark material, is actually pushing out through the lighter material, the annulus, and that's pushing out, it's actually putting pressure not only on the nerve root, but on the spinal cord itself. So that's why oftentimes herniated discs cause more symptomology than just a bulging disc. So what causes harm to the discs? Well, we know that the discs act as cushions between each of the vertebrae of your spine. Over time, these cushions can lose what we'll call buoyancy and start showing signs of degeneration. Discs start to dehydrate, cartilage stiffens, which can lead to cracking and tearing and other damage. We know that damage to the discs can occur as a natural result of wear and tear, but there are certain factors that can significantly increase your risk of having this wear and tear occurring, and then further allowing that annulus to either bulge out or for the disc to herniate itself. Some of those factors include gender. We know that men between the ages of 20 and 50 are more likely to have a herniated disc than other demographics. Some other factors include improper lifting, whether you're using your back instead of your legs to lift heavy objects, or you're just showing other incorrect postures, lifting and twisting. All those things can come into effect. Weight, certainly being overweight puts added stress on the discs, especially within the lower back. Another risk factor is smoking. It's believed that smoking reduces the oxygen supply to the discs and causes more rapid degeneration. In fact, we know that it affects collagen in all parts of the body. Collagen is what makes the discs and what makes the cartilage. Also what gives elasticity to the face, and that's why a lot of smokers will have more wrinkles, but it certainly affects us internally as well as externally. Some additional risk factors are repetitive activities. If you have a physically demanding job that requires constant lifting, pulling, bending, or twisting, or even worse, some combination of these motions. We know that frequent driving can play a role. If you're seated for long periods of time, plus the vibration of the car engine can put pressure on your spine and discs. If you happen to be somebody that works with heavy equipment and construction, that's even worse yet, doing much more bouncing, much more vibration being involved with that. A sedentary lifestyle, going from sitting at a desk all day, then sitting in traffic on the ride home and being stressed out, then sitting on a couch all night, can wreak havoc on your spine, especially if your desk and your car isn't set up ergonomically correct with the correct lumbar support, with the correct leg supports, making sure that we're not stressing or putting pressure on areas that we shouldn't. Even at home, making sure that your couch is facing the TV and you're not having to turn your neck to look at the TV. Certainly you're not lying down on your side and watching TV. All those things put excess stress on the spine, which we certainly don't need. Poor or inadequate nutrition is a huge, huge factor. Lack of vitamins, minerals, or other nutrients to support the disc and surrounding joints can create problems within that disc. And so we want to make sure that we're getting all the proper nutrients necessary. If you're unsure if you're getting the proper nutrients, speak with one of your doctors here at the office. We have some awesome testing that we can do, whether it's SpectraCell micronutrient testing, or just a good blood test to see what's going on, see if you have inflammation going on in the body, and to check your vitamin and mineral status as well. And then having proper curvatures is essential, as we mentioned earlier, making sure that we have those lateral curvatures and making sure when looking at us from the front or the back that we don't have any scoliotic changes. We know that there are 3 natural curves in the spine that give us an S shape when viewed from the side. Again, that's the cervical lordosis, the thoracic kyphosis, and the lumbar lordosis. And we can also add in there that sacral kyphosis to make 4. These curves help the spine withstand great amounts of stress by providing more even distribution of body weight. Think of it as a large spring in the spine that compresses and decompresses as we move. The disc obviously help those as well. Abnormal spinal curvatures, whether that be a straightening out of a lordosis or kyphosis, or whether it's a scoliosis, can put stress on the joints and on the discs and lead to degeneration, disc bulging, and of course, herniations. Poor posture and slouching can cause the spinal ligaments to stretch beyond their healthy limits and can strain the discs even more. And of course, accidents, injuries, traumas, certainly whiplash injuries, falls, all of those contribute to damage to the spine and can lead to progressive degenerative changes leading to disc bulging and disc herniations. We see on x-rays all the time folks that have curvature changes in their spine, and when they do have these curvature changes, it can lead to what we call subluxation degeneration, and that in turn degenerates the disc and again leads to disc herniations, disc protrusions, and all the other disc issues that we can see. So what are some of the symptoms if you have a disc that is bulging, protruding, or herniated? Early symptoms that could give you a clue that the disc degeneration is beginning include back pain, especially if during twisting or bending of the spine. If we have pain or tingling in the arms or the legs, that's certainly not a good sign. And then any pain or numbness anywhere within the spine. So any of these things are symptomatic of a potential disc issue. Now, some of these can come about by simple misalignments of a vertebrae, which we call subluxations. And those misalignments can put pressure on a nerve and create pain. But if the disc is involved, oftentimes that pain will be more intense, more severe, last longer, and not resolve as quickly as a subluxation would. Levels of pain can be anywhere from painless. Some people have disc bulging that's not putting pressure directly on the nerve of the spinal cord and really don't have any pain involved with it. Or the pain can be excruciating. And these are dependent on the location and the severity of the disc degeneration, the bulge, and or herniation. Sometimes the pain can radiate. Radiating pain is called radiculopathy, and this describes symptoms produced by the pinching of a nerve root in the spinal column, causing radiating symptoms. The most common of these is sciatica. Sciatica is one of the most common types of radiculopathy and refers to pain that originates in your lower back and travels through your buttocks and down the sciatic nerve, which is the single largest nerve in the body. That can go down the buttock, down the back of the legs, into the knees, into the shin, even down the whole way into the foot or into the toes. If you've ever experienced sciatic pain, it is very, very uncomfortable. I had a lady tell me once that she gave birth to 6 children and should rather go through all those birthing processes over again as opposed to having the sciatic pain that she was experiencing now. Pressure applied to a nerve from a disc herniation can cause radiating pain along any of the affected nerve pathways, including down through the shoulders, arms, even into the hands, or down into the legs. Interestingly enough, we don't always have to have pain the whole way or symptoms the whole way along that nerve. For example, some folks will have problems within their neck, and that herniation will put pressure on the nerve that goes down into the arm to the hand, but their symptoms may only be in the hand. Sometimes it may even be confused for something like carpal tunnel syndrome. They may even had surgery for carpal tunnel syndrome and didn't get results from it. But when we look at their neck and find that there's disc herniation or protrusion or bulging in there, and we correct that neck, then the symptoms in their hand may dissipate. And this can happen anywhere in the body. A proper case history and physical exam is crucial to the diagnosis of disc injuries. X-rays can further help to determine the alterations in spinal curvatures, arthritic changes, and disc degeneration. And so these are certainly some of the ways that we want to start. And when you come into our office, everyone's going to get a proper case history, a physical, orthopedic, neurologic, chiropractic exam, and X-rays. And this is going to give us the first signs of any potential disc injury in the body. MRIs, or magnetic resonance imaging, usually provides the most accurate assessment of the spine area, showing where herniation has occurred and which nerves are affected, and also the degree of that herniation. Oftentimes when people are having some serious problems, we'll refer out for the MRI so that we can be more specific on the area and we know exactly what we're dealing with. So what can we do if you have disc herniations, disc protrusions. Oftentimes, the medical profession says the only thing that we can do is give you medications, and if that doesn't work, we're going to do surgery. But we know there's a lot of other options, and speaking to your chiropractor is probably the least invasive thing that you can do, and the best thing you can do to get you started. Chiropractic care is a safe and effective way to treat herniated and bulging disc problems by utilizing a comprehensive report of the patient's history, performing physical examinations, like I mentioned earlier, orthopedic, neurological testing, and taking digital images, including x-rays. A chiropractic doctor will diagnose what type of disc problem may be occurring. By correcting the alignment of the spine, nerve endings can function properly and pressure-causing pain can be reduced. Those misalignments, again, we call subluxations, and those subluxations can put pressure directly on the nerves or can compress the disc, causing the disc bulging and herniations. We know chiropractic care can include different forms of spinal manipulation, commonly known as adjustments. And the key with adjustments, especially for those dealing with disc issues, is specificity. That's where the x-rays and exams come into play. We're able to determine the exact region that needs adjusted. And then the particular technique that used is extremely important as well. Here at Gonstead Physical Medicine, the doctors use a technique called Gonstead. There are a lot of other techniques that we may utilize as well. The key is when you're dealing with disc issues, is we want to be as gentle as possible so we don't aggravate or irritate that region. And so using general adjusting procedures when somebody's dealing with a disc issue is extremely important. In some cases, as we mentioned earlier, MRIs are necessary. So your chiropractor may refer you for an MRI to better be able to prescribe suitable treatment plans specific to your needs, including, again, the adjustments, physical medicine modalities, and therapeutic exercises. Some of those physical medicine modalities may include electrical muscle stim, heat, ice, massage therapy, or laser therapy. The therapeutic exercises begin with gentle stretching, and eventually, as you're feeling better, incorporate strengthening protocols and maybe even tractioning protocols. If necessary, you may be referred to a specialist in pain management and regenerative medicine to assist the healing process and for reduction of pain and inflammation while you're being treated. Thankfully, here at our office, we do have a naturopathic medical doctor on staff who's able to do trigger point injections and also regenerative medicine such as prolotherapy and stem cell therapy. So we may need to utilize some of these to help get you out of pain while we're working you through the process and decreasing the inflammation in the body as well. Surgery certainly should be considered your last option. There are multiple risks and multiple side effects involved with surgeries. And I see it all the time in chiropractic. I have so many patients that have come in over the years who say, I wish I'd have never had the surgery. Unfortunately, once you have the surgery, you can't take it back. So you should do everything you can prior to having to have surgery. Now, that's not saying that you're never gonna have to have surgery. We certainly have patients come in that have discs that have broken off and are laying on a nerve, or the disc herniations are just so severe that they may need to have surgery. But we find the vast majority of people coming to our office that are having disc-related problems are able to get complete relief through the treatments that we provide. One of those treatments is spinal decompression. Non-surgical spinal decompression is a type of motorized traction that may help relieve neck and back pain. The system is designed to apply spinal decompressive forces to compressed and degenerative injuries of the spine. It is often recommended as an alternative for many types of lower back pain, including sciatica or neck pain caused by herniated disc, bulging disc, or degenerated discs. In our office, we have a top-of-the-line unit. One that's pictured here is a DRX 9000. It's one of the best decompressive tables on the market, and we get great results with our spinal decompression. Now, the theory behind spinal decompression is decompression works by gently stretching the spine, which changes the force and position of the spine. So when you're lying on the table, your body's in a completely relaxed state, much different than typical traction or even inversion tables. It's key that the body's relaxed, because as we apply these decompressive forces, it begins to spread the vertebrae apart. This change takes the pressure off of the discs by creating a negative pressure. This is really important. Again, no type of tractioning or inversion table or anything else is going to create what we call this negative intrathecal pressure. That negative pressure can actually vacuum the disc back internally. Also, it can bring in nutrients to help heal that region. As a result, bulging or herniated discs may retract, taking pressure off nerves and other structures in your spine. This helps promote movement of water, oxygen, and nutrient-rich fluids into the discs so they can heal. In the majority of cases, combining gentle chiropractic care, therapeutic procedures, and spinal decompression can result in the alleviation of most, if not all, symptoms associated with disc injuries. Including healthy eating habits, weight loss, and proper nutritional supplementation can further help you in recovery. All our doctors here at the office are experts in health and nutrition, and we can make recommendations for dietary changes, supplements that may help in reducing inflammation, supplements that help to reduce muscle spasms, also supplements that can help to rebuild the disc again. And so all those things are important when we set somebody up on a disc healing program. Our doctors will certainly be happy to guide you in your healing journey. So are you suffering problems related to a disc, or you think you may be experiencing disc problems? Well, don't continue to suffer needlessly from spinal or disc-related pain. Make an appointment with us now for a free X-ray or MRI review. If you are already a patient here and you've had MRIs taken somewhere else, bring them in. We'll be happy to review those MRIs or the MRI results with you for free. If you haven't had X-rays taken recently, I highly recommend that you update your X-rays so we can see the health of the spine and see what's going on within the joints and within the discs themselves. So start the care now that can help you return to abundant health and vitality and allow you to resume doing the things that you love, pain-free. And that's so important. One of the key things I always ask patients when they come in is, what do you love doing that you can't do now because of the pain that you're experiencing? Whether it's playing with grandchildren, whether it's just going to work, whether it's golfing, whether it's playing tennis, whether it's hiking, or just doing yard work, whatever you enjoy doing that you can't do, and you thought maybe that you'd never be able to do again, you may be able to do, as long as we take care of the body and help it heal from the inside out. So thank you for attending this webinar. We certainly appreciate it. We appreciate your time. And I just wanted to close by saying, for those who are live in the webinar, stick around for our question and answer period. For all those in attendance, again, thank you for watching this webinar, which of course is entitled Care for Your Disc, the Back Pain Solution. I hope I have succeeded in increasing your knowledge of the importance of maintaining a healthy spine and discs. If you have any questions or wish to schedule an appointment with one of our doctors, please use the contact information found on this slide. Also, if you enjoyed this presentation, be sure to check out additional videos and webinars on all sorts of health topics on our website, or you can go directly to my YouTube page. Just go into YouTube and in the search, just type in Scott Timko and it'll take you to my YouTube page. So once again, thanks for joining me. God bless you and have a wonderful evening.